WNN.
If you suffer from excruciating back pain, do not have surgery. Call Dr. Fernando Ranella, MD, and ask him about the new ozone therapy and how it can eliminate your back pain once and for all. End your suffering today. Call Dr. Fernando Ranella, the Center for Back Pain Management, 561-819-6325. That's 561-819-6325 or injectpainaway.com.
Now you can get Talk 1470 WNN on 95.3 FM too. Loud and clear. Health and Wealth Radio, WNN.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show, living a longer and healthier life. As you just heard, we're sponsored by All County Healthcare, so big shout out to them. They're a Medicare certified home health agency. I'm David, your host for this evening. You can listen to us every Tuesday here, 6 to 7, or 5:30 p.m. to 6 p.m. on Fridays, and we are live streaming on All County Healthcare's Facebook page. So just type in All County Healthcare Incorporated in the browser. If you have any Medicare questions or questions about home health, you can call Maddie at 1-888-717-7170 or go to allcountyhealthcare.com. Wow, we already got 2 viewers on Facebook Live. That's awesome. Last week we had like 15, so I'm looking to maybe double that tonight. That'd be great. I wanted to bring you a little information tonight on what is now the 4th leading cause of death in the U.S. Surprisingly, it's on the rise, maybe even 3rd, because I've seen it both ways in research, and that's COPD, or chronic obstructive pulmonary disease. We have an action-packed program tonight, so I'm going to get started. One of the guests, our first guest tonight, is Dr. Joseph A. Giamo. He's a board-certified osteopathic internist and pulmonologist, so he knows all about COPD and the treatments, and he also practices sleep medicine. So without further ado, Dr. Giamo, how are you doing tonight? Welcome to the program.
Hello. Well, thank you very much for having us this evening.
And thanks for wanting to come on the show. I know another physician told you about the show, so that really means a lot to me that we're having physicians on the show. It's really growing, and that's really fantastic. So I wanted to have you on because COPD. I'm always seeing it in the news. A few years ago, I'm part of the general population here. I'm not a physician, but it seems to be growing. We hear the acronym all the time, but what is COPD exactly? We have a pulmonologist on the program yourself, so we got to ask you, what is it?
Well, COPD is really a combination of multiple different diseases. It's chronic obstructive lung disease. So it's part asthma, part emphysema, bronchitis, and other diseases that people know less about, like bronchiectasis or alpha-1 antitrypsin or cystic fibrosis and all those things. It's any of the lung diseases that cause obstruction to your airflow and cause problems with your breathing. So it's very diverse, and as you said, it's the third, fourth leading cause of death in this country, and it's really because of all the smoking and inhalation injuries that people have suffered over the period of their lifetime.
Yeah, you mentioned an important topic there, inhalation. So it's not only smoking, but I have read where maybe someone who was a painter and sandblasted or breathed in chemicals. Have you ever come across people with COPD who haven't been smokers? Maybe they've dealt with chemicals in the environment and gotten and developed it?
Sure, certainly. I mean, it can happen from medications, too. There's medications that we use, cardiac medications and other chemotherapy medications they use for different types of diseases like rheumatoid arthritis or other types of connective tissue diseases that can cause people to have COPD and lung problems. They can cause acute inflammatory responses in the lungs and cause significant problems. I mean, exposures to fumes, certainly firemen, hairdressers who get exposed to a lot of fumes and those kind of things when they're doing the hair preparations, that kind of stuff, and different occupations. Different people who work in farming and other industries certainly get affected by it.
I didn't know that about medications. Thanks for bringing that to our attention, because I've done a lot of reading and research on this, and I hadn't heard that. So we're learning something new here on the You and Your Doctor show. That is fantastic.
Good. I'm glad to help.
Now, one thing you mentioned early on is smoking. Now, does that seem to be something that can one of the biggest factors that brings on COPD? And can you get, I guess second half of my question is, can you get COPD from secondhand smoke as well?
Certainly. Secondhand smoke, we find a lot of people who we see that their parents were smokers or heavy smokers when they were children, and they developed respiratory problems. They have a higher incidence of asthma and higher incidence of respiratory complications as they get older. If your partner smokes in your home and where you live, co-workers, that kind of stuff, it causes a lot of problems for individuals. So secondary smoke is certainly a big problem.
Fantastic. We already have some comments on Facebook Live. I know Matt Garlick, he is watching the program from Illinois. So this is fantastic. Like, we're getting the word out on, the latest in health around the globe. So that's really neat with help of Facebook Live and radio here. Now, Dr. Giammo, I want to get back to it. So we've all seen that commercial, at least I think we have, where it's the elephant sitting on someone's chest and they're complaining of not being able to breathe or having that stuffed up feeling in their actual chest. Have you ever heard patients describe to you as a pulmonologist that COPD is like having an elephant sitting on their chest?
Well, people describe a lot of difficulty breathing. That's mostly the asthma component that you see with COPD. When people complain about chest heaviness or inability to breathe, we always think first about cardiac issues, and that's the one thing you have to make sure that they don't have to begin with, to make sure if somebody's having acute chest pain and discomfort, you always want to make sure that you're looking at the cardiac causes first. But beyond that, certainly COPD is very common for people, and they can have just a heaviness when they're trying to breathe and those things. So it's a very, very common issue that we see all the time. But that chest pain and heaviness, you always want to think about the cardiac issues, too, to make sure you're not overlooking those.
Oh, no, I didn't know that either. So, being overweight or out of shape can and also become a factor, I guess, leading to COPD down the road? Is that
certainly? Mm-hmm.
Okay.
Certainly, you worry about COPD down the road coming in and having problems and issues for those patients that we take care of. It's always difficult for them.
So you don't have to be a smoker or someone working in a harsh environment. It could be, the choices you make in your life.
Well, exactly. There's sometimes that there's different types of genetically predisposed people. Like there's a disease process called alpha-1 antitrypsin. It's an enzyme your body usually makes, and that some people make less of this enzyme, and the enzyme is very protective for your breathing. What happens is when we inhale gases or fumes or other things, they can cause destructive changes to the lung. These enzymes help protect your lung, and if your body genetically doesn't produce as much of those, you have a deficiency, then those people develop emphysema at an early age and with generally less exposures. So they're not people who have smoked packs and packs of cigarettes or had significant environmental exposures. They may have minimal amount of exposures, and they cause the same kind of problems that you see.
We're here with Dr. Joseph A. Giamo, a pulmonologist and osteopathic internist, board-certified osteopathic internist from Palm Beach Gardens. He has an office in Palm Beach Gardens and also specializes in sleep medicine, which we're going to get to a little bit later in the program. His website is giamolungdoc.com, and I'm going to spell his last name as Giamo, and then you're just going to put in the browser lungdoc.com, 561-775-3883. Dr. Giamo, I know a few of the symptoms, and I've mentioned it, like the elephant sitting on the chest feeling, and I've also talked to a patient who started having trouble walking up just one flight of stairs and mentioned it to their doctor and was actually diagnosed with COPD, and that's actually where I got the story about the painter. He was a painter, and he had sandblasted for years. So what are some of the symptoms that maybe we should be looking out for COPD, or is this something that, a pulmonologist would just see in a visit to the office? They're not really overlying symptoms.
Oh, no, there are all kinds of things that you can see with it. I mean, what happens is you'll get patients who will have something minor, something as simple as just having a persistent cough. Other times it's just having more problems when they're walking. They get short of breath walking up the steps or doing normal activities. Maybe they used to swim or golf or run, and now they're having difficulty doing those things. And frequently you'll see people say, oh, well, I'm just getting a little older now, and I'm just, getting worn out. But it's not really the case. If people have had smoking histories in the past, particularly you always have your ears very acutely listening to their symptoms as far as whether or not they have those dyspnea. And any of those kind of subtle symptoms certainly are things that you can pick up on. If people are fatigued and short of breath, they have a tobacco smoking history or a secondary smoking history, then you worry about COPD for them.
I see it. How do you diagnose it from a pulmonologist standpoint? How do you make the diagnosis?
What we do is we do a set of pulmonary function testing. We do the history and physical. You examine the patient, talk to them, find out if they meet sort of the clinical setting and they have that constellation of symptoms that you would expect. You examine the patient. Sometimes when you listen to them, their lung sounds can be very diminished, or sometimes they can have very coarse breath sounds, depending on if they're bronchitic and having a lot of bronchitis symptoms. And then what we do is a pulmonary function test, which is a breathing test that they do. And the breathing test is a way that we help determine if there's any obstruction to their airflow. We can look at CAT scans and chest x-rays also, but the breathing test is really sort of the diagnostic tool we use the most.
Now, once someone has COPD, is it reversible?
Well, to some degrees, there is a component. Remember, COPD does have some chronic asthma component to it. So with that, yes, there is the reversibility that you have from the asthma component from it. But the majority of COPD, the emphysema changes and those kind of things are not reversible. So we have to sort of keep a close eye with those patients and try to do everything we can to prevent those symptoms from getting worse.
And once you make the diagnosis of COPD, what are some of the treatment options available today?
Well, usually what we talk about, the predominant thing we like to use are the inhaled agents, and there's things called bronchodilators. They're medicines that we give via canisters and different types of devices where people will inhale them, and they go into the lung, and they help open up the airways. In the airways themselves, they have different types of cells in them. Some of the cells are smooth muscle cells, and these will help relax those smooth muscles and help the airway open up and increase the diameter of it so people can breathe. We also give them inhaled steroids sometimes, and we give them other types of agents that help improve things. Sometimes we give pills, sometimes we can even give injections, and certainly sometimes when they have infections, we give them antibiotics and other medications to help relieve their symptoms.
I wanted to ask you, so how long have you been a pulmonologist total? How many years?
Well, I've been down here in Florida for 30 years. I graduated from my fellowship up in New Jersey about 30 years ago, so I've been down here for the entire time.
So 30 years. What percentage would you say has what's the percentage you've seen COPD rise in those 30 years of practicing pulmonology?
Well, I think we're seeing people at a younger age, and I think it's because people had smoked so much in the past that before you used to see people just in the 7th and 8th decade of their lives. with COPD. And now we're seeing people in their 40s and 50s because people started smoking now. Some people started smoking when they were 10, 12 years old, very young. 15, 16 years old, you're starting to smoke, and then you say you've had a 20-pack year smoking history, by the time you're 40. And so we're seeing younger people now with that, and we're picking up those people earlier in their disease process. And it's good because now we have medicines. Before, we used to have medicines that you would just treat symptomatically, and you would treat somebody with an inhaler every maybe 4 to 6 hours because the inhalers didn't last long. And now we have medicines that will last for 24 hours, so we can give them an agent that you could take 1 or 2 puffs of it, and it'll last for 24 hours for them, and so they don't have to continually go back. So I think we're seeing more of it because we're more aware of the symptoms and picking up the diagnosis earlier, and also because we have more effective treatment, so people are driven to try to diagnose these people earlier because we know we have some things that can help alter their outcome.
Dr. Giamo, this is great information on COPD that I don't think really anyone really has the chance to have a pulmonologist on and hear this information. So I just want you to hold that thought. We're going to take a quick commercial, and on the other side, I'm going to talk with Dr. Giamo about IPV treatment, sleep medicine, sleep disorders, and where his practice is located, so we can find out, where to go for pulmonology care on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back with Dr. Joseph A. Giamo, board-certified osteopathic internist and pulmonologist, GiamoLungDoc.com. Dr. Giamo, where's your office located in Palm Beach County?
I'm in the northern end Palm Beach County on Burns Road, Burns and Prosperity, so right around where the mall is.
Oh, okay. I'm familiar with that area. I was born at Palm Beach Gardens Medical Center. I'm from Jupiter,
Great.
That is a fantastic area. Got the address right here, 2511 Burns Road, Palm Beach Gardens. 561-775-3883 is Dr. Giamo's number. I wanted to ask you a question. I had read a little bit about IPV treatments, intrapulmonary percussive ventilation, as an effective form of chest physical therapy. What is IPV treatment? Is that something that kind of breaks up the mucus that kind of causes the congestion?
Yes, it does. What it is it creates a wave of air that comes into the lungs, and it's like getting the back compressed. What we do sometimes is we used to use chest percussion on individuals, and now we tend to use machines and other devices that cause the airway to oscillate a little bit. So it's like cupping your hand and patting on somebody's back, and what it does is it creates movement of the secretions and helps them become dislodged and helps people be able to expectorate out the phlegms better.
That's good to know for a treatment for, some physical therapy for the chest and breathing. Until I did this show 2 years ago, I never knew really pulmonologists specialize in sleep medicine as well. How big of part of your practice is sleep medicine and sleep disorders?
Probably at least a third of the practice are patients that I see with sleep disorders. There's a tremendous number of people who we have, in today's society who have sleep-related disorders. It's really pretty staggering when you think about the numbers that you see of those individuals.
Is sleep apnea at the top of the pack, or are there other disorders that are just as harmful?
Well, there's a number that are just as harmful, but I think sleep apnea far and away is the preeminent one that you see. I mean, it's usually related to obstruction of the airway, and what happens is that, the way anatomically your upper airway is structured, what will happen sometimes is when we fall asleep at night, the airway will close. The airway will close down. And then that is the snoring process that you see with individuals. And then with that snoring process, the oxygen level goes down, and people get great stress to their heart and their other body systems. And when those things happen, you have a higher risk of heart attacks, strokes, and seizures, all kinds of bad stuff that we don't want to see for individuals.
So if I'm told by my wife or a family member that when I fall asleep I have horrible snoring, I can go see a pulmonologist like yourself and get a sleep study? Is that how it works?
Certainly. I mean, pulmonary doctors see it, a lot of sleep medicine. Sometimes other specialties will. Some of the family physicians sometimes can do the screening test and those kind of things for you. Generally, if you're going to have if you have an abnormality when they do the study, then after that you're going to want to see a specialist who's certified. But I mean, the initial evaluation can be done fairly straightforward, and it can be done by a number of physicians. It doesn't have to be done by a pulmonologist, but there's a number of folks that will be able to do that for you.
What are some of the other kind of sleep disorders you see walk into the office on a daily basis?
Well, you see a lot of people have insomnia. That's probably the most common sleep disorder that you see. Insomnia is generally related to other issues. People have very poor sleep. It's called sleep hygiene. They just don't sleep well. Maybe they drink a lot of caffeinated beverages, coffees, teas, stimulants, other things. The energy drinks and the energy bars, or maybe they're doing things that are counterproductive to their ability to sleep. A lot of times people will fall asleep with the television on, or they'll have other things. So they'll do other strenuous activities before they try to fall asleep, and all those things can disrupt your sleep. So insomnia is one of the big things that you'll see also, and it causes a lot of problems for individuals, certainly.
It's funny you mentioned that because it's in the news, and I was watching the health briefing for the president today, and one of the reporters was asking, does he sleep? Has he talked to you, doctor, how much he sleeps? And I was shocked to find out he only sleeps 4 to 5 hours a night. So they were kind of trying to get to see if the doctor would look more into that. So it's funny you mentioned that insomnia, because I think maybe we may hear more about that in the future. It was in the news today.
Oh, certainly. It's a huge thing. It's the most common sleep disorder that we really come across, because you find so many people, if you just talk to people at work and you talk to people, in your social circles, and they'll say, well, they just had problems sleeping last night, this or that happened. Sometimes as they get older, you have to get up and use the bathroom more frequently, or they have other issues. Maybe they have problems with some chronic back pain, or they have a dog that they have to go and let out or something like that. There's a whole host of things. You have young kids. Anything can cause your sleep pattern to be disrupted. And then when that does happen, it's hard to get those things back sometimes. So we're trying to just make sure that we try to do the best we can for our patients and try to help support them as best.
And the key word is pattern. So if you have, a sleep disorder or something, causing you not to get a good night's rest, definitely see a pulmonologist or see Dr. Giamo there in Palm Beach Gardens. I wanted to ask you, starting with sleep apnea, how are sleep disorders treated?
Well, sleep apnea, there are three methods that we treat sleep apnea with. And we first of all, we do the testing. And when we find out the patient's thing, it's called an apnea-hypopnea index. It's basically, think about it like your scorecard or your batting average of how well you sleep. And you want that number to be very low because that means you're having less disruption to your sleep. So if it's less than 5, it means it's normal. If it's over than 15, then you really need to be treated. So when we do the studies on you initially, and generally we'll do a study on you where they have monitors on you in the evening while you're sleeping, and that can either be done in your home or it can be done in one of the certified sleep centers. The sleep center studies, they measure 16 different parameters, so a number of different things, looking for different types of processes that can cause sleep disturbance. The home studies measure less parameters, usually anywhere from 5 to 7, and they're more of a screening test for patients. So you go through one of those testings, and then after that, if they determine that there is a problem, then we usually I'll talk to my patients and say, well, these are the 3 ways that we can treat your sleep apnea. The first way and the most deceptive way is to treat you with what's called a CPAP or a BiPAP machine, basically a very tight-fitting mask that fits either over your nose and your mouth. And what it'll do is create a column of air, so when you fall asleep at night, the airway won't close down. It has a cushion that helps prevent the airway from closing. That's the best way to treat it because over the period of your lifetime, we can always adjust the mask and we can adjust the pressures and doing those things. So CPAP or BiPAP machines are the best. If they can't tolerate that, then sometimes we fit people with oral appliances and they can go and see their dentist, or sometimes some physicians will do that, but mostly dentists will do this. And what they do is they put in a mouth guard similar to what you see an athlete wear. But the only difference is instead of just causing the teeth to come together, this causes the lower jaw to jolt out a little bit. And when it does that, it opens up a space and causes you to have more airway movement when you sleep at night. And then last way is surgical techniques. And surgery is generally reserved for children or people who have anatomical problems, structural problems with the airway that are fixed. And there's a number of different congenital diseases that cause malformation of the jaw and those things that you need. And in children, the tonsils can be very enlarged, and the treatment of choice for them is to get the tonsils out. But those are the 3 best things, and there's newer things that are coming out now. There's different types of stimulant, different types of electric probes that they put in, and that can put in on some of the nerves in the neck and help stimulate the neck if people are intolerant of these other treatments. So sleep medicine is continually evolving, and there's a tremendous amount of research being done. But the best treatment right now is to really use either a CPAP or a BiPAP machine and have somebody keep an eye on you when you're using it.
Wow, I didn't realize that there were so many options. That is great news to the community. What hospital are you on staff at? Your office is near Palm Beach Gardens Medical Center. Are you on staff there?
Sure. I go to Palm Beach Gardens Hospital and Jupiter Medical Center. Those are the 2 hospitals. But I've been in town a long time, so I have gone in the past to St. Mary's and Good Sam and 45th Street, which is now, I believe, JFK Hospital North and Wellington and Palms West. But my 2 main hospitals are Jupiter and Palm Beach Gardens now. Those are the places that I go.
That's fantastic. Wow. You've got it covered for northern and central Palm Beach County. Are you still clinical assistant professor at Nova Southeastern University's medical school?
Yes, I do some teaching down there with the students, and I take students on our rotations and do those things still. And
you're a doctor of osteopathic medicine, so that's the medical specialty that you teach, correct?
Yes. The difference, osteopathic and allopathic medicine, MD and DO medicine, are similar, and what they do is that you go through 4 years of college and then 4 years of medical school. I went to an osteopathic school, so my degree is as a doctor of osteopathic medicine. And then after that, I went to fellowship training and 5 years of internship, residency, and fellowships. So I'm board certified in internal medicine, pulmonary medicine, and sleep medicine. And I teach the whole gambit of that. Osteopathic medicine has always been a philosophy. It always been a very holistic approach to the human body, where you look at systems and how they're integrative with each other. So an osteopathic approach is slightly different than an allopathic or an MD approach, in that we look at the body as a system of integrated parts, and where traditional allopathic medicine, MD medicine, looks at it as a body system, where they look at it, well, I'm a pulmonologist and I'm seeing a patient for a respiratory issue and I'm dealing with that, instead of looking at the whole pattern and picture. So it's something a philosophy that I enjoyed earlier in my life, and I felt that it was the right way to look at medicine. So That's why I do it. But the medicine, we all practice the same now. Everybody does the same certifications and all those things and testing and all that stuff.
And medicine took you all the way to Capitol Hill to the White House. You were actually on Capitol Hill and testified in a briefing?
Yeah, I had an opportunity. I had been asked to serve for the Physicians Advisory Council for Medicare. They select 15 physicians across the country in various fields, and it's a presidential appointment. I was appointed by the first President Bush to go and serve. And what we do is we were acting as a intermediary between the government, between CMS, Centers of Medicare Services, and the physician population, and we would go and meet on a quarterly basis and discuss different policies and how they could be implemented and things that they would do to help look out for our patients and care. And then after that, I was also asked to come up to the White House on a few occasions to help with the Affordable Care Act. There were some problems. The Affordable Care Act was really meant to bring the 45 million people in this country who didn't have health insurance into the health system. And, there were some good benefits to it, and there were some challenges when they've had some challenges with that integrating into the, getting more people to sign up and those things. They reached out to different physician communities. And I have been very involved with the American Osteopathic Association, my national organization. And as part of the national organization, I was in D.C. and I was asked to come up and speak. And then after that, I was asked again to come back and speak with the CMS director at the time and speak with the people in the White House about how we could help implement the Affordable Care Act to help have people sign up and get health care.
Well, thank you for that service. That is just fascinating, the amount of work you've done in the last 30 years. That is really something. I always like to ask the question at the end with the doctors, what are your hobbies and passions in life outside of medicine, if you have any time? I mean, you seem to be pretty busy.
Well, it is like I think all of us are very busy in our lives. I mean, I enjoy spending time with my wife and my two children, and we like to travel a lot. I've been into photography, so we like to go and do those kind of things. But it's really spending time with my family is a big thing, and I'm a big sports fan, so I like to watch football. That's my big hobby.
Who's your team?
I'm from Philadelphia, so I'm an Eagles fan. I've been going to the games since I was 6 years old. I used to go with my father So I still suffer, as my wife says. I'm a suffering Eagles fan, but I still enjoy going to the games and getting a chance to, and I've actually indoctrinated my kids into it. So I've taken both of the boys up to games in the past, and they're starting to get into it. So it's what I enjoy.
Well, we know what you'll be doing this weekend. Big game for you. So Good luck. I gotta say it. I'm a Dolphins fan, but pulling for you.
Well, I got to thank you for the running back then. I have to thank you very much for the running back.
Yeah, that was a nice gift mid-season. He is a great running back. And I Google the doctors before I go on. I think everyone Googles names nowadays. And one of my favorite shows is the Now in South Florida and on Channel 5 News. And I didn't know that your wife is Shannon Cake, the anchor reporter for WPTV.
Yes, she is. So she's So I have to tell her she had competition tonight because we're competing for her viewers tonight.
Well, thank you for coming on the show. You're always welcome on the program. Such great information tonight. I really thank you and really appreciate it.
Well, thank you so much for your service. I appreciate what you're doing for the community. It's nice to get information out there, and thank you for the opportunity tonight to get a chance to speak with some folks.
And that's Dr. Joseph Giamo, GiamoLungDoc.com, 561-775-3883 with an office in Palm Beach Gardens. Was, as you heard, he's on staff at many hospitals in the area. On the other side, we have Rebecca Hayesi from the American Parkinson's Disease Association South Florida chapter, going to talk to us about an upcoming Parkinson's disease symposium on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back. We're here with Rebecca Hahasi. I hope that I got that right, from the American Parkinson's Disease Association, South Florida chapter. Rebecca, welcome to the program.
Thanks, David. Thank you for having me.
Definitely, and I know one of the reasons I wanted to have you on for a while, because Parkinson's disease is so important to find out. The network of not only caretakers but organizations like yourself, APDA, South Florida chapter, can really help, families, caregivers, and people with Parkinson's disease who, that's the whole focus. So you have a upcoming symposium. It's the third annual A Comprehensive Approach to Parkinson's Disease Symposium this Saturday.
Yes.
Right here in Boca Raton.
Yes, at the Marriott. Yeah.
That is fantastic. Tell us a little bit about the symposium. I had went to one of the symposiums in the past. But tell us a little bit about the third annual and what's different in 2018.
Sure. Well, we're definitely very excited for the third annual symposium. What's different about this one this year is we have breakout sessions, and we have a killer keynote, which I'm actually really super excited about. And this year it's pretty much doubled in the amount of people coming. We have, as of today, as of earlier this morning, we had 253 people. Last year we had 154. What's nice about it also is that we are offering the community CEUs. So if you're a speech language pathologist, physical therapist, occupational therapist, nurse, a respiratory therapist, or paramedic, you're able to get CEUs for a great cost. For 5 CEUs, it's $40.
Oh, wow.
Yeah.
So tell us what CEUs are.
So continuing education units or credits, depending on what it is, if it's OT, PT, speech. And most of the time, people who have those type of licensures need to make sure that they have continuing education. And there's not really much out there for Parkinson-specific education. So we're hoping that a lot of people come, hear what we have to say, and really are there to educate themselves in Parkinson's disease.
So doctors, physical therapists, occupational therapists who deal with Parkinson's disease treatments can actually get those CEUs at this conference.
Yes, they can. Yeah.
For only $40.
For $40. Yeah, it's
Wow.
really inexpensive. So basically less than $10 a credit. We partner with St. Mary's Medical Center that helps to provide some of those CEUs for us. Really thankful for them. That's the second year we're doing a partnership with them. So they're really fantastic that we're able to provide that for the community. And then, of course, people with Parkinson's, caregivers, family members, other health and medical professionals, like a lot licensed massage therapist is coming. I spoke to her this morning. So anyone really interested in the disease because they're interested because they have a loved one or they work with people and just want to know information, everything and anything is going to be talked about. And as I said, there's a lot of stuff, webinars and teleconferences that go on. We even at our national office do that, but something locally, not much to this caliber. So very excited about it.
Oh, definitely. And will you be taking people up until the symposium starts, or is there a certain number then it closes? Or I mean, you're already at 203 people.
253, and I'm
253. I'm sorry.
253. Yeah. I was gonna take registration down on Friday to get organized. I would say maybe give me a call at 800-825-2732, and I'll let you know, because we're pretty close to our max, which I thought was at like 260, 265. I knew we could hit the 250 mark. So maybe give me a buzz, and I will let you know and see how we're doing. But it's gonna, it's a lot of people. So
that is.
It'll be exciting.
Why do you think it jumps so much from year to year?
Well, just the word out. I mean, our organization ourselves, we've nationally been around since the 1960s, 1961. Our local chapter really has been around in the community, but we were an INR center originally. We became a chapter 3 years ago. So we've just been out in the community more, building more relationships, talking more with support groups, health and wellness activities, just getting the word out. So, of course, that takes a little bit of time. I've been going now on 2 years being with the organization. And I just knew it would, and these people want the information, because as I said, there's really, I mean, it's very much Alzheimer's, dementia, really Parkinson's, even though neurological conditions, it's number 2 behind Alzheimer's, just nobody really talks about it.
Yeah, that's
so
right.
So it is, a lot of people have it. 1 million people in the U.S. have this disease, but just nobody really talks about it.
And I can attest to your work as an organization. In the 2 years that you mentioned you've been here, we've worked together many times, press releases when I have time to write, and other options as well to get the word out on Parkinson's disease, because as everyone knows, I work as a PR manager for a large physicians group, but I work more with your organization than some of the other bigger ones that I'm not going to mention. I don't want to get anyone put anyone on the spot, but that's a test to the job you're doing, because to have that many people sign up before the event is just amazing. Let's talk a little bit more about the event. The keynote speaker, I've never met the doctor, but as soon as I saw the Scripps Research Institute of Florida, I've been there a few times. That is a huge catch there to have to join you as a keynote speaker.
So exciting. I actually brought her bio because I'm even super impressed by her. We ended up meeting her through a physical therapist who had a patient who worked on the board. We actually went to Scripps, went to go see, and she was doing, I think, research, and something came back on Parkinson's research, and we heard it right there. And so she's amazing. So she's the professor in Department of Immunology and Microbiology in the Department of Neuroscience at Scripps. She holds, so not only does she have a PhD in neuroscience, but she has a doctorate of veterinary medicine also. Because that's what you do. That's, internationally recognized expert, Parkinson's, Alzheimer's. She worked with experimental evidence with the prion disease, with mad cow disease. She is an advisor with World Health Organization. She's done stuff with FDA, EPA, USDA. I mean, this woman is amazing, and she's so great, so down to earth, and just excited. Loves it. Loves talking about research like a kid in a candy store. We were super excited. We kind of mentioned it to her. We're like, "What do you think about this?" She's like, "I'd love to." And we're like, Scripps, yes, this is fantastic.
That is really great.
Really,
and to have her come to South Palm Beach County, because as everyone knows, Scripps is up in Jupiter.
Yep.
But this will be great. I mean, this is a no-brainer to actually, pardon the pun, but to get involved with this. It's the 3rd annual A Comprehensive Approach to Parkinson's Disease Symposium this Saturday, January 20th. I wrote that it was 9 a.m. to 5 p.m. It's pretty much 9 to 5.
Yeah. It's a long day. We've got a few general sessions. Each breakout, there's 3 breakouts that are about 40 minutes. We're definitely going to try to stay on time. She starts us off in the morning at 9:35. An introduction is going to be super short and sweet to the point, and we're just going to kind of move and groove and get people all the information and education that they need.
And I have right here, she's going to discuss molecular and disease mechanism. I knew I was going to get that wrong. Mechanisms of Parkinson's disease, as well as new neuroprotective treatments.
Yes.
Wow, tongue twister there.
No clue. That's what I said. Like, what is she talking about? I'm like, exactly that. That's all I can tell you.
That sounds like a new treatment for Parkinson's disease, though. And
exactly. And because she actually does a lot of, gets a lot of grants. So she's also, working on a lot of stuff that's, really underneath the thumb as far as new treatments coming out. She's probably right there working with a lot of stuff.
And then the first breakout session I'm reading here is about exercise regimens with Parkinson's disease. I guess that's important for maintaining, quality of life.
Very much so. This one speaker actually kind of canceled or had a little thing and had canceled, but I'm having two physical therapists speak at the symposium, which is really important because actually clinical studies and trials, medication just doesn't help slow the progression of the disease. It just helps with the symptoms. And actually clinical trials and studies, the only thing that has shown that has actually helped to slow the disease is exercise. So it is very important to move. It is very important for physical therapy and all sorts of aspects. So definitely wanted to have physical therapists presenting information, new information, telling people this is the newest, studies, trials, everything that's going on as far as exercise goes.
Did I read a study last year or the year before about riding a bike can help with Parkinson's disease ailments?
Yeah, so it was a guy, if you do a YouTube video, you see this older gentleman, he's probably about in his 80s, and he's bicycling, no problem, but he gets off and he can barely walk. So they're really still not Parkinson's is a movement disorder. It's a lack of dopamine in the brain. So they know that when we move, we're producing dopamine. Why exactly? It's the biking. I mean, as any probably neurologist would tell your physical therapist, just move. Whatever it is. If you want to dance, go dance. If you want to do boxing, rock steady boxing, go rock steady boxing. Like if you want to do yoga, do yoga. We just need you to move. Like there's not one that's better than the other. Is there one that fits you better? Probably. But just do it. Like we need you to move. And not only for Parkinson's, just for your health in general.
Yeah.
So if you need this as an excuse for just move. That's all we want them to do.
And this is what I really wanted to get to. Dr. Lloyd Zucker, everyone who's listening to the program, friend of the program, knows he was on last month, December 5th. One of the most fascinating interviews I've ever had. He's a neurosurgeon, and he works with Dr. R.F. Dalvey on deep brain stimulation surgery. So he's going to be talking about that topic. And I've actually seen a patient who's had this procedure done and they have the tremor. Think of, if you're listening on the radio, someone who has the tremor in the arm's moving back and forth. Well, Dr. Zucker and his colleague, Dr. Dalvey's a neurologist in movement disorders. He maps the brain. Dr. Zucker puts a lead from the brain to a neurostimulator in the chest, and then Dr. Dalvey can program with a computer to turn the tremor on and off at certain times. That is the most amazing thing I've seen in medicine to date.
Because they allowed me to be on a surgery too. Did they let you be on a surgery?
I haven't been to a surgery, but I've seen the patient about a month after surgery, and the patient was kind of joking with us, have Dr. Dalvey turn the tremor on.
Or you're like, what?
And then the arm is flapping uncontrollably. Yeah. And then Dr. Dalvey with the computer turns off the tremor.
Yeah. It's amazing.
I never thought.
DBS is definitely very interesting. Dr. Zucker, as I said, I got to actually see a surgery, so it was very fascinating just to watch it in general. Very nice guy, though, very laid back. But yeah, he's going to be there talking about the neuromodulation with DBS and anything new about current probably programs that are out there. There's a lot of different ones. Like I know Boston Scientific has a new program. Abbott has a new program. Medtronic was kind of always out there, but now there's Bluetooth, now there's wireless. So he's going to go over and talk a little bit more, and as you mentioned, about the mapping, about how that's come, and there's a lot of advances in that too. So again, very fascinating. Of course, DBS is not for everyone. It doesn't help with all of the symptoms, but anyone who I speak with who in our support groups who have had it, I mean, for the most part, thumbs up.
Yeah, if you want to know about it, I've seen both Dr. Dalvey and Dr. Zucker speak. I know they've done over 500 procedures together. It's just worth it to check out his presentation. And as you mentioned, you're going to have the device manufacturers at the symposium as well.
Yes, we are. That's going to be Abbott will be there as far as DBS. So if anyone's interested in seeing one up close, I mean, they should have it there. Hopefully, Dan, if you're listening, please make sure you have it there.
Dan got some homework.
By the way. But yeah, no, we've got a lot of great sponsors there too. We'll have a lot of stuff and product there. So it's a great opportunity for people, to see these things and really to talk to people right there and just ask these people questions. I mean, that's they know what's going on.
So how can people sign up to the third annual A Comprehensive Approach to Parkinson's Disease Symposium this Saturday, January 20th at the Boca Raton Marriott?
So you can go onto our website, which is apdaparkinson.org/FL. On the front main page, there's a link right there that goes to the symposium that'll take you to all of the breakout sessions. You can see what's happening for that day. I'd like to try to push people to the website instead of calling the 800 number because it is just me. So I'm doing a lot of things besides answering the phones and getting everything ready for the symposium this weekend. But if not, you can also call if you're having problems, 800-825-2732.
And video of this broadcast is going to be on AMP2 TV's YouTube page later this week, so people can check it out there. And as everyone knows, the Facebook Live page for All County Healthcare Incorporated, the sponsor of this program, the videos live there as well as allcountyhealthcare.com. So you can check out the information. We actually put it up on the screen for the video, so you'll be able to see it there as well. And let's talk a little bit more about there's a couple more breakout sessions, and I want to get to Dr. Dalvey is going to be talking about clinical research. So I'm looking here. The next one, physical therapy intervention, changes to the respiratory system. Wow, Parkinson's disease affects different systems in the body as well. I didn't know that. I thought it was just a tremor. Wow.
Yeah.
Learn
so
a new thing.
The speech therapist, the speech language pathologist actually going to be there that day is actually from a very cool company called Speech Vive. And it's actually some new product out there. So when people have Parkinson's, of course, everyone's very different. It's very individualized. But for a lot of people with Parkinson's disease, they have issues with their speech, swallowing issues. So sometimes what happens is they can talk very, very fast, and then they talk very, very quietly. So you don't hear them. So, and again, this isn't something that they're aware of because they think that they're talking normal to us. So this is interesting. So Speech Vive is actually a little product. It's kind of like a hearing aid. Anyway, there's a long, schematic that kind of goes with it. Basically, though, you put it behind your ear. It makes a little sound into your inner ear that makes that person, if they have Parkinson's, speak loudly. Very fascinating. Again, super cool. Very cool. So anyway, but she's a speech language pathologist and going to come talk to us about all the problems and issues and concerns it has with Parkinson's, because a lot of things that happen, drooling's a big thing that happens with Parkinson's. A lot of people don't like to talk about it because it's embarrassing.
Is it normally on one side of the body or can be on both?
Yeah, it's
That's a quality of life thing.
Yeah, and exactly. And as for someone, and it's for, I have a woman who hates it and carries a little towel around, and she, has ways to try to do it. She does a lot of stuff with Botox too, but at some point it comes back, and then it's not that she's producing too much saliva. It's just there's so many muscles and in our face, that's a movement disorder, so it's slowing. So for you and I, I'm swallowing as we're talking, and I'm not, I'm producing the same amount of saliva, but I don't have Parkinson's. So that really happens a lot with them. So she's going to be talking about a lot of great things. We have a few people talking about cognitive difficulties. It's another thing that nobody wants to talk about, with whether it's some memory issues, or even like depression. Some stuff with hallucinations, delusions. There is actually a commercial out about Parkinson's and a medication about hallucinations, delusions, because that can happen also. And again, it's something that not everyone wants to talk about, because I had someone say to me once, Parkinson's is not a sexy disease. I don't think any disease is sexy, but you're right. It's definitely not something that people just want to talk about, and they can hide it for a little bit. So a lot of great topics, hot topics that come up in our support groups or come up that maybe they don't talk about with their doctor. Maybe their doctor doesn't even cover because there's so many other issues. I mean, these are like the secondary symptoms that come. The primary ones are, you had mentioned tremor, slowness of movement. There's other things that happen that people just don't talk about because there's just so many other issues with it. So I'm going to talk about it.
You're right. Until Michael J. Fox came out with Parkinson's disease, I'll be honest with you, I had no idea what it was.
Mm-hmm.
One of the first things I looked up was the name to find out where Parkinson's came from. But kudos to him for doing so much for bringing this disease, to the forefront. But like you said, you don't really hear too much about it. And here we are in South Florida, and we have a great opportunity, a symposium. And this is the most thorough, jam-packed, informative symposium that I've seen. I've been to a few. I go to a cardiac one and another neurology one. So kudos to you, too, for putting this together.
Thanks. And I also want to thank Dr. Dalvey. So he's our medical director. I do want to give him some props, too, because he really helped with this. And same with the Palm Beach Neuroscience Institute. They are our top sponsor. And he helped put a lot of this together and said, why don't we talk about this? We put some ideas out there, and he kind of really helped to formulate stuff. And then we just kind of helped with everything else. So this is his then third time here really helping us out with this.
So I know Dr. R.F. Dalvey actually worked for him outside of the radio show.
Yep.
You can see a little bit more about him at pbni.com, but he does work with Dr. Zucker on DBS programming, but Dr. Dalvey told me many times the amount of research that went into Parkinson's disease in the last few decades was going on, and now we're seeing everything come to the forefront. So now he's going to tell us even more updates on clinical research that's going on right here at the symposium. He's speaking in the afternoon, so that's just going to be fascinating. He's talking a little bit about the FDA, neurorestorative therapy, and that is just going to be amazing.
He's going to have a ton of stuff, a lot of updates, some new drugs and medications coming out, so it'll be very informative for anyone attending, definitely.
And he's a great speaker as well.
He's very good, very thorough, and very in the mark. I never have to really, I'm like, it's 2 minutes, then he stops right on the mark. I'm like, he's so good at that.
University of Chicago, educated, did his fellowship at Columbia in New York, just an amazing. And then you're finishing with a Parkinson's disease doctor right here in Boca Raton, Dr.
Chapria. Yeah, she's with the Parkinson's Disease and Movement Disorder Centers of Boca Raton.
And then after that, a general session where all the doctors kind of talk a little bit about what was learned during the day or any questions and whatnot.
Little case study, too.
So check it out. Third annual A Comprehensive Approach to Parkinson's Disease Symposium this Saturday, January 20th at the Boca Raton Marriott. Rebecca, thank you so much for coming on the program.
No problem. Thank you.
And have a good night.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or